A lot of people getting COVID right now in the Valley, and on top of that, there's confusion about who could get an updated COVID-19 vaccine. The Food and Drug Administration recently announced new federal guidance.
The change is prompting backlash from medical experts across the country, especially as we get into COVID season. 12 News journalist Jade Cunningham has more on what people here, many of them angry, are saying about it.
Mesa resident Jane Kepsel is frustrated.
Yeah, I'm concerned because I do have risk factors.
Because she's been trying to get a COVID booster.
I usually get my vaccines at CVS.
But keeps hitting roadblocks.
When I went online to make my appointment, it wouldn't let me make the COVID-19 vaccine appointment. And I went to a doctor and got a prescription and that didn't work. So what more can I do as a patient trying to take care of my health?
The 64-year-old says she's taking a trip later this month and wants to be protected. But after the Food and Drug Administration recently announced new federal guidelines for COVID-19 vaccinations, things are in limbo.
I'm really angry that this is happening to our healthcare system. It wasn't great to begin with and they're going to make it worse. Why does the federal government need to dictate to me whether or not I get it?
It's all up in the air right now because we just don't know what the Advisory Committee for Immunization Practices and the CDC are going to decide.
Arizona Public Health Association Executive Director Will Humble says that group, the ACIP, is looking at the FDA's tightened guidelines for several vaccines.
So it's not just COVID-19 that's a vaccine that's at risk. It's the MMRV vaccine, it's the human papilloma virus, HPV vaccine, and others.
The uncertainty comes because many members of that group were recently replaced by Health and Human Services Secretary RFK Jr.
This new committee of people, many of whom are anti-vaccine and anti-evidence, that's what's the real risk, is that the members of this committee are very different from the evidence-based academic type folks that have been on this committee for so many decades.
The FDA recommends those 65 and up, as well as adults and children with underlying health issues, get the booster. Still, it raises questions about insurance coverage and if prescriptions will be needed. Humble says only time will tell.
What they do in a couple of weeks will directly determine whether viewers that are watching this are going to be able to get the vaccine this fall for COVID-19 or not, and maybe even some of the childhood vaccines.
As for Kepsel,
do I cancel my trip? What do I do at this point? And there are no answers out there.
She continues the hunt for a COVID booster and is hopeful clarity will come soon. Jade Cunningham, 12 News.
So the committee is scheduled to meet at the CDC headquarters in Atlanta to discuss these guidelines in about 2 weeks. And the updated COVID vaccines have been approved by the FDA. They're expected at pharmacies in the coming days.